My name is Marcelina Stewart. Again, this is my patient, Josefina Barrett. I'm going to perform the assessment of the eyes, ears, nose, mouth, and throat today. First, I'm going to start with the eyes. With the eyes, I have to make sure that her eyebrows, you could bring your eyebrows up and down, eyebrows. Move your eyebrows up and down, and I have to make sure they're symmetrical, there is no scaling and or lesions. With her eyelids, I'm going to ask you to close down your eyelids and make sure they're symmetrical, there is no swelling, there is no redness to the eyelids, and they look nice and straight. Now I'm going to take a look at her eyeballs, and from the side of her face, I'm going to flash a light to make sure the eyeballs are aligned, they do not protrude, or they're not sunken. So I'm looking at her first eyeball on the left side. They're not protruding, they're not sunken in. I'm going to look at the other side. You can look straight ahead, and they're not protruding and they're not sunken in. And they are aligned. The next step, I'm looking at if there is no sign of palpebral fissures. Looking at them, in some other cultures, palpebral fissure meaning that some of them could have Down syndrome, but as we see, the palpebral fissure are normal. There is no sign of Down syndrome that we can see. And in Asian, some of them have like the chinky eyes. No, that's not a right phrase. But there is no sign of Down syndrome. The next step is looking at the conjunctiva. And also looking at the conjunctiva, I'm going to just press down, and they look nice and pink. In some black patients, the conjunctiva could appear gray, but these are nice and pink. They're both nice and pink actually. And there is no redness, there is no swelling, or there is no sign of infection, which is a little bit of discharge that we will notice. Are you having any pain?
No.
Okay, no pain. So, but they look nice and pink. Also, if I pull the upper lids, and I'm looking at the look down for me, and I'm looking in to see if I see any redness in both eyes. There is no redness. So when we pull up, there is no redness. They appear clear. Next, I'm going to check for accommodation, which is a flashlight into the patient's eyes. And when we do the flashing into the patient's eyes, we're going to see that accommodation occurs when we flash the light. The pupils are constricted. Now I'm going to bring it closer. Can you look straight ahead for me? And I'm going to try to see if we can get that, to see if we can find. Open your eyes. I don't know but I can see pupil constriction, and I'm going to do it also in the other eye. Look straight ahead, and pupil constriction occurs when we shine the light in the eyes. Also, if you look close straight ahead, look at my finger. There should be pupil constriction with the fingers a little bit farther away, and when it comes closer, the pupil will accommodate to look at the finger. And with the cornea, we are making sure they're smooth and they're not irritated. You can just look straight ahead. And they're clear. And that's what we're seeing right now. Now the pupils are round, regular, equals in size. They are without redness, they're smooth, they're clear. Now next I will talk about the ears. The ears are symmetrical in size. They both need to be symmetrical in size, which they are. If I look inside, they're nice and they're clean, they're not flaky. Right? The pinna, it's firm, and the tragus is firm. Sorry. Both of them are firm. These are the tragus, they're nice and firm. And I'm checking our mastoid process. And we're looking for no tenderness. There is no tenderness, there is no swelling, there is no redness, there is no discharge also. So they're both nice and clean. Now we're looking at her nose. We're gonna look at her nose. Now the nose has to be midline, which they are. And there is no looking at them. I'm going to look into her nose, which is part of the assessment, of course. There is no lesion. They're nice and they're pink. Bend down a little bit. We're looking into her nose. Okay, there we go. Nice and pink. Let me see. Turn this side a little bit. I'm having a little difficulty. Okay. And with the nose, the nasal cavity and the mucosa, they are moist. They're smooth and they are nice and pink inside. The septum, which we were looking at, looks clean. Now, next I'm going to look at her mouth. I'm looking now at her lips. Her lips are pink. In some patient, which with the black community, they appear bluish, but hers a little bit discoloration, but that's normal for her color of the skin, with a little bit of pink. If I looked at her teeth, you can show your teeth. They're nice. Open your mouth. Can we come down a little bit? Now her teeth are nice and white, and if I look at her gum, you can open up your mouth. Her gums are nice and clean. Can even, if you stick your tongue out, there is no tremors of her tongue. When we're doing cranial nerve 12, we can check to make sure the cranial nerves are working. And if you stick your tongue out, you're going to find that the cranial nerve 12 is working perfectly. You just got to stick it out. And it's nice. There is no tremors, and it's aligned. Also with her mouth, we will do her upper teeth. Let me show you upper teeth. Open your mouth. And with her gum and upper. Okay, so we're showing her. It's too close. So her gums are nice. I just want to point that out. I did her tongue, and if I look, open your mouth, wide open. And I'm looking at her tonsils. Her tonsils is a 1+. That's definitely, they're not red. They don't have any discharge. And they're not swollen. And that concludes my assessment of the eyes, the ears, the nose, the mouth, and the throat.